4 times entry speed into the skin, and it will not cause any tearing or any scratching. You would actually stitch the skin. The XCellaris Pro Twist can be used for multiple indications, and we're going to use different needle depth depending on the area that we're treating. So as an example, if we're treating on the face, if we think about the face as a whole, the skin is thinner on the forehead and around the eyes, the nose and the lip. So we're going to treat at slightly lower levels on those areas where the cheeks and the chin and the neck can take a higher needle depth. And what we're looking for is visual endpoint, or the clinical endpoint. So it's not always about the needle depth, it's about what you visually see on the skin. So if we're treating patients for hyperpigmentation, skin tone texture, we're going to treat at a roughly 0.25 to 0.5 needle length, and that would be over the cheek area. And then we're going to do 0.1 up to 0.5 around the lips, nose, eyes, and the forehead. And what this is going to do is ensure that we're in the epidermal layer of the skin and the epidermal junction. And the visual clinical endpoint for this is uniformed erythema and swelling of the skin. If we're going to look for acne scarring, deeper wrinkles and lines, we're going to needle at around 0.5 needle depth up to 1.5 needle depth, depending on the size of the wrinkle as an example. And the visual endpoint for this is some pinpoint bleeding. We might be looking as well for lots of erythema and swelling on the skin. Now, if we're looking for the odd blood spot on the skin, we know that we're in the upper part of the dermis. We're in that papillary layer of the dermis. If we are getting lots of pinpoint bleeding, then we are at the reticular layer of the dermis, which is our lower level of the dermis. If we think about scalp, we're going to needle at 0.5 to 1 millimeters, and this is then going to create a small amount of pinpoint bleeding to regenerate that blood flow back to the hair. Again, the scalp is thinner on this frontal area. However, as we move to the back of the scalp, the skin becomes thicker and we can, of course, increase needle depth. When we think about needle depth as well and speed, it's important to remember the speed when treating the patient. So if we were to start as an example on the side of the chin or the cheek area, and we start at 0.5 millimeter needle depth, we're going to needle over the area in fast circular motions. Once you've passed the area 2 to 3 times, if you're not getting that mild erythema or swelling on the area, before you turn up the depth, you should turn up the speed. Because if you turn the speed up, you're going to create more microchannels, and this will give a different reaction in the skin. Once you've turned up the speed, if you're still not getting the reaction you are after, then you will look at turning up the needle depth. So we always choose speed first and then needle depth. If we're treating striae, so stretch marks and medical scars, we're going to use a needle depth of 2.5 millimeters. And this is to ensure that we're entering the lower part of the dermis and also the hypodermis. We're going to use a speed of 150 so we can guarantee more channels. And what we're looking for here for medical scars and for stretch marks is lots of pinpoint bleeding and what we call pétaché, which is like a blood bruise. And you want as much as possible to create as much blood flow back into the area. When we're treating with the XCellaris Pro Twist, we can actually treat in circular motions. So when we're treating over the skin, we're going in fast circular motions like so. And the reason we can go in circular motions is because we've got that 4 times entry speed into the skin. The needle architecture and shape means that we can go in these circular motions and it will not cause any tearing or any scratching, because the active needle retrieval is being actively driven into the skin and retracted at the exact same rate. With other devices in the market, you have to go in lines, or what we call the crosshatch. And the reason why you need to go the crosshatch method or the stamping method is because if you were to go in circles, you would actually stitch the skin and you would create an open wound. So this is the only device in the world that you can open and clean on the inside. So the needle cartridge has an anti-flow back inside the cartridge, so there's no cross-contamination getting into the device, and the device also has anti-flow back in the seals. With other devices, what you will actually find is that you are screwing the needle into the end of the device, and if you do have any contamination onto this is actually living inside the device forever and can pose cross-contamination to your next patient. With the XCellaris Pro Twist, you can see here that you can open the gate, you can actually clean the inside with 70% alcohol plus and allow this to air dry. You can attach the needle directly into the motor itself, so you can clearly see that it has its active needle retrieval, no cross-contamination. You can clean across the entire device, it is waterproof, all down the lead, across the control unit itself as well.